And I'm joined by Dr. Blair Davison of St. Pat's for another edition of Morning Rounds. Thanks for joining us.
Well, thanks for having me.
Today, our topic is PTSD. First, what exactly is it?
So PTSD stands for post-traumatic stress disorder. And so the best way to think about it is that when something traumatic happens to us, we are biologically primed to have a certain response, and it's usually that fight or flight response. And when you think about PTSD, it's really that response lasting too long and causing too much impairment. So PTSD are the functional impairments after a traumatic event. And commonly these are intrusive thoughts, nightmares, flashbacks of the trauma, avoidance of things that make you remember what happened, hypervigilance, an increased startle, and sleep disturbance.
Who is affected by PTSD?
So anyone can be affected by PTSD. All it takes is an exposure to a traumatic event, which unfortunately are all too common because they come in all varieties. In the U.S. right now, it's estimated about 1 to 6% of the adult population has PTSD. Children can have PTSD, and there's some groups in which PTSD is more prevalent. Women are 4 times more likely to have PTSD, and then the Native American population has about double or triple the rates of PTSD.
So for people with PTSD, what are some of the treatments out there?
So that's the good news, is that they're really good treatments. And as anyone who's ever had a traumatic or frightening event happen to them, and you can't get too far in life without that happening, you know, things do get better with time. But then talk therapy can make a big difference. There's a certain kind of therapy called exposure therapy where you kind of re-experience various elements and kind of condition your body to have a different response than that flight or fight response. And then sometimes there's a role for medication.
All right, are there any other tips or topics you'd like to cover about PTSD for us this morning?
I guess the most important thing to think about is that we all have, unfortunately, traumatic events in our lives. And that after an event, it's a really good idea to talk about the event with people who are supportive and caring. And if you feel like those things like nightmares and flashbacks are persisting too long, to seek out some help and some support.
All right, well, thank you for some of those tips for us this morning. If you'd like to send us a question, you can email it to us, morningrounds@kpax.com.